telomere shortening has been implicated in almost all aspects of normal aging. And what I'd like to do is I'd like to just give a few examples, and I'll start off with the number 1 and 2 causes of death. Cancer. When our telomeres get short, our chromosomes become unstable, and the rearrangements of our chromosomes cause mutations, and these can induce the expression of oncogenes and de-repressed tumor suppressor genes, increasing our risk of getting cancer. In addition, when the telomeres in our immune cells get short, our immune cells lose the ability to fight the cancers. So it's two things happening here. Short telomeres increase our risk of getting cancer and decrease our ability to fight the cancer. Atherosclerosis. When you look at the cells lining your blood vessels, the endothelial cells and the smooth muscle cells, you'll find that if you look at the telomeres in the cells surrounding plaque, you'll find those telomeres are shorter than the telomeres in other parts of the blood vessels. And this is because we think that the cells have gotten older through telomere shortening, and as a result, they are less capable of preventing plaque. So if we could find a way to prevent that telomere shortening, this could be a possible way of preventing plaque and even fighting plaque. There's a lot of disease, lack of time, I'm not going to go into all of them, but people are welcome to talk to me throughout this conference. I can tell you the basics of telomere biology in all of these, but they include Alzheimer's, osteoarthritis, osteoporosis, just general skin aging. They include macular degeneration, which is the #1 cause of blindness in the elderly, liver cirrhosis, muscular dystrophy, AIDS. Now, you all remember back in the early 80s when AIDS epidemic first came around, doctors were saying that they don't understand why their patients don't have any T cells. Well, we now know that the immune cells, the T cells in the immune system, put up such a fight against the AIDS virus, and the fight was unsuccessful, but because of this fight there was lots of cell division, and the telomeres got very short in these immune cells, and the immune system died of old age, and that's why the AIDS patients don't have T cells. Now, if we could find a way to prevent the telomere shortening in these immune cells, the immune cells would stay around, they probably wouldn't be successful at fighting the disease, but the person might be able to live a normal life. General immunity, stem cells. Every time I go to a stem cell conference, doctors are asking me, have we come up with a drug to prevent telomere shortening yet? And I always have to say, not yet, but the reason why they're asking is because when you take stem cells out of a person, you have to expand them in culture. You have to get more numbers of them. You have to let them divide. Well, because of the cell division, the telomeres are getting shorter, and so the cells that they put back into a person end up actually being older than the cells they took out of a person. So the people doing stem cells need a drug that will prevent telomere shortening when they're doing stem cell therapy. There's a lot of diseases. Anything you can think about that involves cell division is going to have telomere shortening. And one thing I want to leave you with is that bad things happen when telomeres get short. There's nothing good about short telomeres. And there's also nothing bad about long telomeres. So it would be good if we could find a way to keep the tips of our chromosomes long. We have found that when the telomeres get really short, they do start lengthening. Okay, so the critically short telomeres do get longer, and that's why everybody who's on IsaGenesis is seeing some age reversal things. Like even me, I've seen age spots disappear on my hands. I've seen my vision get better. I've seen my endurance get better, and it's all explainable by IsaGenesis.